Hope you all are doing well. I am Katie, and this is kind of a makeup, if you will, from the scheduled February in-person meeting that I hear many of you made the effort to attend, which I truly appreciate, and certainly apologize for having to cancel last minute. I'm so excited to still have the opportunity to share my passion with you all. That's truly what it is. And it subsequently has developed into a full-blown practice, medical practice and business, which is what brought me to Mountain Women in Business. Um, I went back and forth. I've done several different presentations in different settings on hormones and hormone replacement therapy. I think it's definitely a sector of medicine that's starting to gain some momentum, but still there's a lot of unknowns. And really landed on this presentation being most appropriate for this group. What I'm finding in practice is that there definitely is a hurdle that I really want to hone in on today with you all in terms of I think in society, but also specifically in healthcare for women and even more specifically in the hormone space for women. There's kind of a mental hurdle that we have grown to normalize that we kind of have to push through to even acknowledge or ignite awareness on hormones and hormone replacement therapy or hormone support and what that could mean for you. So this is titled When Normal Doesn't Feel Normal, the role of hormones and why so many women feel dismissed. I want to start by saying something that may sound simple, but I think is incredibly important. And that is that if you have been feeling off, maybe now or in the recent past, or tired or overwhelmed or just not yourself, first of all, you're not alone. And second of all, you're not crazy. This is so common, and I think that's part of the drive in this presentation today is to start to bring some awareness to that. I work with women every day in this space who are capable and driven, intelligent and successful, women who are running businesses not unlike most of us in this group, families and entire mental loads, not just for themselves, but also for those around them. And these powerhouse women are still quietly, internally wondering things like why everything suddenly feels so much harder in life and various avenues of life. Many of them have been told that their labs are normal or that it's just stress or part of being a woman. And so my hope today is that I can give you the language for what your body may already be trying to tell you. And I think just as importantly, permission to stop dismissing it, but also to stop letting others or accepting dismissal from others, even clinicians who you trust with your medical care. Um, so that's my hope for today. But before we dive in, I want you to know who's standing in front of you and why I care so deeply about this topic. So my name is Katie, for those of you that don't already know me. I am a PA, and my background, the bulk of my career for over a decade now, has been in internal medicine, kind of in the typical mainstream medicine setting for a big healthcare conglomerate. Beyond that and that training and experience, I stepped outside of that and I've become a certified clinician in the Hormonal Health Institute program, which I really take pride in. I'm an active member in the Menopause Society, which definitely is fitting in this space, and ultimately founded Collab Hormone Health to create this space where I could start to tackle some of the issues that I see in women's health in particular. uh, because I felt really restricted in that mainstream medicine space to really be able to do some of these things under big healthcare conglomerates and insurance companies and that kind of thing, which I'm sure all of you at one point or another have felt frustrations in those regards. I can guarantee you clinicians feel the same frustrations. Um, just as important, and if not more, I am also a mom and I'm also a woman. And when I tell you that I have had lifelong issues with hormone and metabolic health, it's not an exaggeration. I can remember being very young and having some issues in that space. And so, both as a patient and then later on as a clinician, dealt with some of that dismissal and never really finding a clinician who was listening and willing to kind of dive beyond just kind of the standard of care that's been developed over centuries. So both as a patient and as a clinician, unfortunately, in that internal medicine space where I practiced for the most bulk of my career so far, I actively participated in that dismissal, right? Of women who I would cross paths with and was typically providing care for that entirety of my career. Um, Still participated in that dismissal just due to lack of education really in the medical school system in the hormone space. So I'm not here because I've always had this figured out, even as a clinician. I'm here because I didn't, and I wanted to do better for myself and for my patients. So this dismissal that I experienced and provided as a clinician, I see this pattern over and over again. And in my opinion, that it's why this conversation matters so much. Um, so many women are told, I'm just realizing I didn't advance any of the slides here. It's getting really into my speech. This is me, and here we are now. So, why this conversation matters. So many women are told that their symptoms are normal. And as a result, these busy, capable women often decide to just kind of push through their feelings of feeling awful or not themselves. And I think that's the crux of part of the problem is that women are really good at adapting. And especially if you're told that something's normal or this is just what you can expect in different phases of your life, we do accept it and we're really good at adapting and kind of just shouldering that and pushing through. My question to you today, and what I ultimately ended up asking myself as a patient and as a clinician later on, is should we be? Should we just be adapting to these changes that we expect throughout the different phases in our life, specifically when it comes to hormones? Um, or should we be asking why and maybe trying to do something about it? Before we talk about hormones, though, and labs and all of those fun things that I am really passionate about, I want to start with something much simpler. I want you all to look at this list and do kind of a quick gut check, is what I call it, where you read through the list and kind of internalize what's resonating with you, what you've felt maybe recently or just in the past, or feeling now as you sit here listening to me speak today. Um, you might be surprised that more than just one checkbox, there could be several that fit you. And what's fun too, and I never, when I'm giving these speeches, I certainly, I think HIPAA is ingrained in me as a clinician, and so I never ask for an actual raising of hands as far as who all is experiencing these symptoms. But you may be surprised that for a lot of these, there would be several hands raised, and even more so that those same hands would be raised for multiple symptoms, which you might find in yourself as well. So it is striking, certainly, when you really sit and think about it, or start to discuss these things with other women, how common they really are. And I think that's important. That's an important point to bring about because you start to feel validated in your feelings. Oh, it's not just me. Um, as a clinician in this space, certainly that's striking, just really how common it is. But even more striking, in my opinion, is how quickly we dismiss a lot of these. And this is a very short list. I will be providing Deb a PDF to send you guys with this recording um, to look through. It's a much more extensive list. But even in this short list of symptoms that I encounter with women a lot, even when I was writing this list, one thing that might shock you is how quickly we dismiss a lot of these. So even if we're willing to acknowledge that we're having these symptoms, the next hurdle is that, again, we as women, I think in particular, quickly try to explain or kind of write off some of these things. So, as I was getting to when I was writing this list, it was a heck of a week. And I was saying things like, gosh, yeah, I'm exhausted but wired. But I would quickly explain it away. Yeah, but the kids have been sick and there's been a lot of personal issues going on or whatnot. Or sure, yeah, my weight has gone up a little bit recently, or I've had more struggle in the gym. But I also haven't been going to bed as early as I said I was going to. And we just really quickly start to dismiss these symptoms. If we can even get past that initial hurdle of acknowledging them, then we very quickly write them off, which is a problem because then we just let them ride. Um, excuse me. Here's why we do that. Here's why I find in talking with my patients that we do that. And when you just look at this systematically as a whole, we've normalized these symptoms instead of asking why. And these are some of the things that we've been taught. Feeling exhausted by your mid 30s is normal. Weight gain after kids is inevitable. Mood swings are just stress, right? It's how you're handling or not handling your stress. It's on you. Low libido is just a phase. And again, this is a short list, but these are some of the things that we really have grown to normalize. And because we've accepted these as normal, instead of asking why, we end up just adjusting our lives around how we feel. Now, to be fair, and some of you might already be jumping to this in your heads, of course, there's external factors. So when you're kind of going through the list and you're explaining some of it away, well, sure, when you're having a week when all your kids are sick and you get sick too, like, yeah, you're gonna be feeling a little bit run down, probably exhausted, probably not getting a lot of sleep. Sure, there's external factors, and those play a role, absolutely. And I think in particular, the modern woman, which we all qualify as, right? And specifically as business owners, modern life does absolutely place real demands on our bodies. Um, Whether it's the business ownership, it's just the mental load of life, the chronic stress and poor sleep, under eating, over exercising, just constantly always having to be on. Absolutely. We have to acknowledge external factors as well. As much as I would love to, I can't blame everything on hormone fluctuations that we expect throughout our lives. But here's the thing, stress isn't just emotional. It absolutely, physiologically, biologically is hormonal. And there's this stress hormone loop that dictates not just your day to day and how you're feeling and functioning, but it also affects your long-term health and your longevity, which I am just as passionate about having my background in internal medicine. So this isn't about weakness and kind of succumbing to the fact that there's external factors that are going to affect you for the rest of your life. It's about helping your biology meet modern demands. Acknowledging the biology, so the changes that we expect to see through different phases of our life, specifically when it comes to hormones, working with that biology, helping you to meet the modern demands in life, not just succumbing to it. And this is where hormones come into the picture. This is what I do. This is what I get to do every day. The hormones are not villains that are wreaking havoc internally and externally. They're messengers. And when you start to understand hormones this way, symptoms stop feeling random and they stop feeling like things that you don't have any control over, that you just have to kind of deal with. The symptoms become messages that you need to listen to, not inconveniences that you have to push through. So hormones are messengers. It is impossible to find a tissue, a cell, a system in the human body that does not have hormone receptors. That's not in some way mitigated by hormones. They affect energy and mood, sleep, metabolism, bones, heart health, brain health, stress response, and I could go on. And if you ever do a consult with me, I will go on. There's a lot to discuss in that regard. But they also don't work in isolation. And we've already touched on that a little bit, right? There's certainly external factors as well that the hormones will respond to. So there's that, and then there's also just the normal phasic changes throughout our life with things like puberty and our fertile years and perimenopause and menopause. So the hormones don't work in isolation. There's internal and external factors absolutely that are going to have a play on those. Ultimately, kind of the take-home point here with just understanding hormones is that the symptoms that come from them are signals, not character flaws. So these are physiological signals and changes. It's not a character flaw that you're just not managing your stress well, or that you could be doing better with diet and exercise. Those things might be true, but that's not all that we should be chalking it up to. So once you start accepting the symptoms as signals, the next question typically that I get is, when do these signals start to show up? How do I know that it's not just external factors, like a really rough week of sleep? And you might be surprised. So truthfully, the real answer is that you can expect this throughout your life. There's natural phasic changes throughout a woman's life that we expect. Um, but specific to perimenopause and menopause, where most of us are going to be fitting in, specifically in this group, hormonal shifts can start decades before menopause. So before that actual loss of a period, if you are still having and can still have periods, decades before. I treat women 18 and beyond because that's typically when I start to see a lot of this dysfunction. But our late 20s is when testosterone starts to take a nosedive. And then from then on, it's just a roller coaster of hormonal fluctuation, sometimes over decades, where you're ultimately landing in this hormone deprivation called menopause. Between that time period, there's stress, underfueling, and those will accelerate symptoms. There's external environmental factors, which we have touched on a couple times already, also going to accelerate symptoms. And here's where things get really tricky when women can even, if they can get beyond the acknowledging the symptoms, listening to the symptoms, when they go to say, hey, doc, PA, nurse practitioner, what's going on with me? Symptoms often precede abnormal labs, especially in the classically trained way when we're not really looking for the nuances. Um, they'll precede the labs, and so you're often sent home being told everything's normal. And this is where so many women get stuck and feel dismissed and kind of just give up and feel hopeless. Here's the thing, one of the other major take-home points I would like you to kind of internalize here is that you can be normal on labs and still be suffering 100%. Normal labs certainly don't always feel normal. And in my opinion, and with my extensive training, what I find truly is that reference ranges definitely and often are not optimal. So optimal relating to optimal function. And quickly, without going into too much detail, I wanted a brief explanation of where those normal values come from. Like if you go to a LabCorp or Quest or Your provider just draws blood in clinic and then gets back. You get this report where here's where you are, here's where normal is. Those normals are quite literally a general population sampling. And the only abnormals that will trigger outside of kind of a normal range is about 2% on the high end and 2% on the low end. That's 4% total that might get triggered. 96% is in this normal range where I can guarantee you there's misdiagnosed, undiagnosed, and people who are certainly landing in this normal but not feeling normal. Um, Part of that problem also is that labs are just a snapshot in time. It's not really indicative of patterns, which is really where hormone evaluation shines. You really have to look at patterns. And again, symptoms often show up first. So a lot of times women will go in and they'll be sent home. Your labs are normal. You're fine. Try to get more sleep. Try to exercise more. Try to eat better. Um, and again, I'm not saying that those things aren't important. They absolutely are, but I think we hang our hat on them way too much, especially in women's health. There's a lot of gaslighting in that regard, in my opinion. The last bullet point here, and this is fun for me, is that women's hormones fluctuate constantly. So I joke about this all the time, but I genuinely don't think I have a single female patient, and male patients to a certain extent, but female patient who initiated hormones the same way, labs look the same way. It's just it has to be like an individualized journey. So that's fun for me. And I've learned the nuances from the, Hormonal Health Institute training, to not get frustrated by those labs and to actually say, hey, this actually is telling me a lot. So that's fun for me, but that can be really frustrating and misdiagnosing for a lot of women when they do seek care from a clinician. So women are confused because nothing's wrong. That's the point I want to drive home here. They're not confused because nothing's wrong. They're confused because symptoms appear long before the conventional markers explain them. And unfortunately, and this is a failure just of the healthcare system in general, their clinicians don't know any better or are very limited in their ability to understand the nuances of labs and combining them with the patterns of their symptoms. This is why patterns matter more than any single number. And these are the patterns that I very commonly see. And so I want you guys to really take stock of these, do a little bit of kind of self-assessment and hold these so that you can hopefully start to see some of these symptoms as more than just something to write off. So very commonly, and I should preface by saying too, there's a lot of crossover. It's not that progesterone only does this or estrogen only does this. And these are very shortened lists for sure, for sure. So, but low progesterone can be anxiety and poor sleep. I see that very often. Estrogen imbalance, whether that's in perimenopause or when you ultimately lose most, if not all of that estrogen, is going to be the menstrual changes. So either periods start to get irregular if you're still having periods, or the complete loss of a period with menopause. Weight struggles are huge. Estrogen stored in adipose tissue, fat. And so the body thinks it's helping by packing on more of it as we lose estrogen because it's trying to hold on to as much as it can. So it's not you. It's not you. Hot flashes too. So when you think of estrogen insufficiency or deficiency, you're thinking of hot and dry. So whether that's vaginal changes or skin changes or night sweats and hot flashes, those are going to be big estrogen patterns for sure. Low testosterone, and there's a lot of crossover here actually with thyroid. Low thyroidism is a lot more common than you would think. And even if you didn't struggle with it throughout most of your adolescence or adulthood, I tend to see the thyroid get dysfunctional as we age in women as well. So low testosterone is low energy, low libido, elevated blood sugar, and elevated cholesterol as well. And this is where some of the internal medicine, preventative medicine fits into play. As a prescriber, very commonly, women would start to come in their 40s and 50s, and suddenly, having never had a problem with their A1C or blood sugar, glucose, or never having had an issue with cholesterol, not really much of a family history, the numbers would just slowly start to pile on. And I would say something that I'd been taught, like, yeah, this happens as we age. We really just got to start to, you can't eat what you used to, and you can't get away with as little exercise as you used to. You really have to ramp that up. And here's a cholesterol pill, or here's a medication that's going to help with your blood sugar control so that we don't get to diabetes, or to reduce that if we're already there knocking on diabetes door. Um, so a lot of this is upstream as well, and I'll touch on that more a little bit later. But thyroid dysfunction is going to be fatigue, brain fog, digestive issues. And again, there's a lot of crossover here, and this is a very short list. But the point here is just that symptoms are not random. They are patterns, and these patterns deserve investigation. Um, Frustratingly, though, despite how common these patterns are, this is the story that we've adapted. And this is the story we need to let go of, because this belief is what keeps women from seeking the answers. Um, Not just in the space that I practice in with metabolic health and hormone health, but I remember being in the ER and even in like the cardiology realm. This would delay women from seeking care when they're having a heart attack. Granted, we also, us women, we like to be a little bit difficult in some regard in terms of not presenting classically for a lot of things, but women would often present late for stroke-like symptoms or cardiac symptoms, because we truly have internalized this, and also just gotten used to adapting and kind of pushing through. Um, and that myth is that feeling awful is just part of being a woman. Now, the good news is that once we can let go of this belief and really start asking why, and should I just continue to push through and adapt, things can begin to change. They do change, and they will change. And I've seen it in myself, but also have seen it in the women that I've had the opportunity to work with and to treat. Um, so what can be different? What are some things that maybe would be resolved if we can start to optimize instead of just normalize, and really support the body's function, specifically when it comes to hormones? Um, well, we see a lot of day to day, but also preventative changes. So definitely more stable energy. We see improved sleep. Sleep is so heavily mitigated by hormones. And then, of course, sleep also plays into a lot of just your day-to-day functionality. Um, Feeling like yourself again. I can't tell you how many times I've heard that exact phrase. I just feel like myself again. Or when someone's first presenting, I don't even know who I am anymore. I just don't feel like me. Um, we can really start to support, kind of that mental shift back to feeling like yourself. Understanding your body instead of fighting it, which I think is really empowering for women. You feel less like things are affecting you and more that you are taking effect on your life, which is so empowering. Um, and then again, being the internal medicine PA, I love this last bullet. Um, it just allows us to be more proactive in the preventative health space and focusing on upstream medicine. Right. So not as much band-aiding with pharmaceuticals for cholesterol or blood sugar or antidepressants. And that's not to negate the life-changing effects that those also have. But my goal for every woman that I work with is to try to mitigate as many of those things in just correcting a lot of the upstream medicine, which is the natural hormone loss that we see over time and hormone dysfunction we see over time, as opposed to relying or solely relying on certain pharmaceutical medications. Um, So again, just to reiterate, I hear things like, I have energy again. I feel like myself, my weight finally makes sense. Right? I'm seeing my effort play out in real life, the effort I'm making with my diet and in the gym. I'm sleeping. Katie, I'm sleeping again. Um, and I think just as importantly, I just don't feel dismissed. I'm being listened to, I'm being heard, which helps a lot from kind of a mental standpoint. So I guarantee you there's been lots of tears, generally of elation with a lot of like follow-up visits. And so, I mean, my gosh, with that, how could I not want that for everyone and be just as passionate about treating and actually getting to get dirty and treat, but also just like with this group, just wanting to educate and help you advocate for yourselves with any clinician, whether or not it's me, just really trying to kind of peel back these curtains of acceptance and really start to advocate for yourself. So that said, it's important to be honest about what this isn't, meaning hormone replacement therapy or hormone optimization or support. It's not a quick fix. It's not a one size fits all. Like I said, every one of my female patients in particular is just on a very different journey, different prescriptions, different delivery methods. Um, it's also not about pushing meds. Certainly, one of my main goals is to try to avoid a lot of the pharmaceuticals we typically end up on as we age. It's about understanding your body and recognizing that individualized care does matter. And so here's what is true. And I hope that I have planted at least a few seeds in the women listening to this today, that even if you don't work with me, I hope that you stop accepting that this is just how it is and fill in the blank. This is just how it is when you're a business owner. This is just how it is when you're a mother. This is just how it is when you're in your 40s or 50s or 60s or 70s. Um, and ultimately, I want you to lead with this. Sorry, I keep forgetting to advance. This is just what it is not and what it is. You deserve answers. You deserve to be heard. You deserve individualized care. I hope you take that with you today. So this is what I want to leave you with. My goal today wasn't to turn you into a hormone expert, and some of you might be a little bit disappointed. I could do a follow-up recording, or please, I'll make sure Deb has all of my contact information when she sends us email. Please reach out to me if you had more specific questions about hormone replacement therapy in particular, and different treatment options and delivery methods, and what should I be asking my clinician? What exactly is happening in perimenopause or menopause? Please send those to me. Um, but that wasn't today's goal, certainly to turn you into a hormone expert. I would love for all of you to be, for sure. But again, we have to change this mindset that we've adapted before we can go there. Um, the goal of this was to help you see your symptoms differently, hopefully, um, not as a personal failure, not as weakness, and not as something to simply push through and accept. Um, and so if something resonated with you today, I encourage you to stay curious about that. And you don't need to have all the answers, but you do deserve to be able to ask better questions when you are potentially seeking care in this space. And with that, typically I would open things up for conversation. Again, with this being pre-recorded, we don't have the capability of doing that, but I still want you all to feel like you've had an opportunity to ask some burning questions you have about this aspect of it, kind of the mindset shift that has to happen, or more specifics about the physiology or prescription options, treatment options, what you should have your clinician look for if they're willing to. And obviously, of course, any of you who want to work with me, I would love to. I would love to provide that service for you. Again, I'll make sure Deb has all of my business contact information. Um, yeah, I think that's it. I will try to kind of close this down. Thank you so, so much, both for understanding when I had to cancel last minute in February, and giving me the grace, to be able to try again, with this pre-recorded version. Being part of this group has been so meaningful, and I truly want to support all of you in any way that I can. And with this kind of being my expertise, I would really like to help educate you and help you advocate for yourself with your clinician, or with myself, because it is so, so important with the day-to-day functionality, but also when you're looking down the line at preventative health. I'll leave with this kind of last spiel. Having worked in internal medicine, I think that especially, with the current healthcare system, we've done a really good job of keeping people and women alive for a really long time. Um, Life expectancy is much higher than it was even just a few decades ago. Unfortunately, we haven't really looked at what that looks like, what quality of life that there is in, living into our 80s and 90s and sometimes beyond. And that's where I'm really passionate. Sure, it's one thing to feel blessed enough to be able to live, for extended period of time, but if it's in a nursing home with, a broken hip, or cognitive changes where you don't recognize the people around you, um, uh, cardiometabolic changes that have really made life difficult, reoccurring UTIs that we see a lot with aging, directly related to hormones. I just think we deserve better, and, we deserve to advocate for ourselves in wanting that to look better. And it's okay to not just want to accept what we've been told aging looks like, particularly here in America. So go advocate for yourself. Reach out to me with any questions you might have. And thank you again so, so much for giving me this space and this time within your day, to watch this recording. Thanks, guys. Okay.